it's almost like a part gets fragmented out, and it's the part that holds the trauma. And then we start building protective layers around it because our nervous system says, I don't ever want this like really horrible thing that happened to happen again. So from the IFS perspective, those structures that get built up around it, we call them protectors. And there's two different types of protectors. In IFS, there's a manager. These are our proactive protectors. So this is what we try to do to make sure the trauma doesn't get triggered. Oftentimes this looks like control, manipulation, avoidance, anxiety. If I'm going to try to control the shit out of my environment and feel a sense of security, if I'm not going to get wounded in this way, of course our system is going to do that. So the other protector part in IFS, they're called firefighters. And this is a reactive protector. So this is what happens when our trauma gets triggered and we're trying to make it stop. And so this can sometimes look like anger explosions, somebody totally shutting down. And there's generally a sense of feeling out of control. But just kind of inviting in a sense of compassion and awareness that like, if somebody is acting like a 2-year-old, maybe that's because there is a traumatized 2-year-old inside of them that is trying to get their needs met. And also saying that none of that is an excuse. It's just one theory about why it happens. And it is our responsibility as adults to do our healing work and not perpetuate the harm and trauma that we experienced onto others.